I think we are experiencing a very exciting time for the treatment of myeloma patients, as novel therapeutic interventions are becoming available for this patient, particularly for patients with relapsed refractory disease. And among the novel agents that have been recently introduced, basically I would love to talk about the monoclonal antibodies. And it looks to me almost a paradox, the fact that we are talking about myeloma, a disease of the bone marrow, where the tumor cells themselves produce antibodies. And now what we are doing is basically using monoclonal antibodies to target and to kill the tumor cells. And basically two are the major players in this scenario, and there are basically two antigens, which means proteins, called SLAMF7 and CD38. And we have indeed available two monoclonal antibodies, named iltuzumab and daratumumab, which target respectively SLAMF7 and CD38. There have been several preclinical, in vitro and in vivo works that have demonstrated the efficacy in targeting tumor cells, either alone or in the context of bone marrow microenvironment. And of course, all those preclinical work have been translated and transposed into the clinical setting, and indeed several clinical trials have demonstrated the efficacy in terms of benefit for progression-free survival and overall response rates. I would like to say that those agents are particularly active even in the context of patients with adverse prognostic factors such as deletion 17p deletions. And these are actually, it's an important things to be taken in mind. And if we overall summarize what's available today, we can certainly say that those antibodies are offering us novel opportunity for treating those patients, even at high-risk disease, either initially or whose disease has gone through several multiple relapses. From a safety point of view, the antibodies have been shown to be well tolerated. There's no additional toxicity on top of other conventionally used agents. Indeed, those antibodies are used, for example, in combination with bortezomib or lenalidomide and dexamethasone. They are quite well tolerated. There are probably infusion-related reactions, and we would probably need a longer follow-up for better definition of the safety profile.